Do not try any of the experiments you're about to see at home.
We are professionals.
On today's show, we'll be busting myths on babies and their vision.
So, quiz for you. How well do you think a baby can see?
I was watching Family Guy the other day, and it seems like Stewie can see pretty far.
Okay.
Oh my God, she's so hot. Look at that, she can fit that whole bottle in her mouth.
Okay, so how should we do this? First, we need a baby.
Yeah. Well, I did some research and we can use Leia paddles. So let's start this.
Okay.
So basically the idea is forced preferential looking, where we have the baby will tend to look at stripes rather than nothing at all. So here we have the Leia petals. So you always have the gray one in front. So there we go. This is baby Chloe right here. And she's looking at this one, which is similar to a 2200 line. Okay, so this is similar to a 2040 line. And as you can see, she is not looking at any of the petals because she cannot resolve the lines. You can also use other methods to test VA in infants, like telar acuity and optokinetic nystagmus. With OKN, the baby will make slow eye movements toward the direction the stripes are moving and make a fast compensatory eye movement in the other direction. This is all if the baby can resolve the stripes.
OKN temporal to nasal response is normal, while nasal to temporal is not. Normal up until 3 to 5 months. In this child, we would expect symmetric OKN responses. So as we saw, baby Chloe couldn't resolve past 2080, which is 4 times as big as 2020. And also research has shown that babies don't actually get to normal acuity until 3 to 4 years old. So what do you think?
Well,
We call this myth.
Busted!
Hi, I'm a third year from SUNY Optometry. I've never seen a baby wearing glasses. Is there ever a time when babies need glasses? Well, that's a very good question. When does anyone need glasses?
People need glasses when their eyes don't focus objects correctly. This is called refractive error. There are several types. One, which everyone knows as nearsightedness, occurs when light focuses in front of the retina. Farsightedness occurs when light focuses behind the retina. Astigmatism is when there is a different refractive error in different meridians of the eye.
Most babies are born slightly hyperopic, but they don't need glasses because they are able to focus their eyes to make up for it. However, some babies, just like adults, have a refractive error that makes it hard for them to see clearly. How do we test for that, huh?
The first test we'll do is called photorefraction. This is when we take a picture of a baby's eyes using a flat. The picture will tell us what kind of refractive error they have and about how much of it they have.
Cool. We will be doing photorefraction on baby Courtney. We put the camera at 20 feet, focus on the pupils, and get the baby's attention. The room lighting is as dim as possible, then we take 3 pictures. Here's one of the pictures we took. First, we look at the location of the light crescents in the pupil. The light crescents are caused by blue circles on the retina. A crescent on top means that the patient is myopic, while a crescent on the bottom means a patient is hyperopic.
The crescent gets bigger as refractive error increases until about 10 diopters, when it fills the whole pupil and sensitivity is lost. Looking at this picture, we can see that the right eye has no refractive error, while the left eye has about 4.5 diopters of myopia. Another way to test a baby's refractive error is called retinoscopy. This is when a light is shined into a pupil to determine the amount of refractive error in the eye. Today we will be doing a technique called Mohindra near retinoscopy. This is done at 50 centimeters on one eye at a time in a totally darkened room. We find the lens that stops the movement of the light reflex and subtract 1.25 diopters to get the baby's prescription.
After doing these tests, your doctor will determine whether or not your baby needs glasses. Babies can have the same kind of visual problems that require glasses as children and adults. Good vision is very important for a baby because they rely on it to interact with their environments and learn to move around.
If a baby's vision is not corrected in time, they may experience permanent vision loss in that eye, called amblyopia. This is especially true after cataract surgery or if the two eyes have different refractive errors. So do you think it's true that babies never need to wear glasses?
I think we can safely say the myth is
Busted!
Hey Jamie, you want to see the cutest video?
Sure.
Okay.
No way, is this real? Can babies really have depth perception this early?
I have no idea. Who should we call?
Dr. Sedgwick!
Okay, we have Dr. Sedgwick here on the line from SUNY College of Optometry.
Okay, so Dr. Sedgwick, we have a question for you. Do babies really have depth perception?
If an infant has depth perception, the infant will avoid crawling off an edge.
So, how do we test this?
And we'll be using the visual cliff apparatus to test this.
So as we can see here, baby Chloe won't crawl off even when her mother calls her.
Babies actually develop spatial perception as early as 1 month, shown by the Lumen response.
Some researchers show it might even be earlier than this, showing that convergence and accommodation are used to judge size and shape constancy. So we call this
Confirmed!
Other tests we can do on a month-old are cover test, motilities, and color vision.
And if all else fails, use bubbles! And just because we love explosions on this show,